Are flailing, mortgage payments are being missed, and the struggle continues. That is the message from some mayors in Snohomish County to Governor Inslee. They're calling on him for a recovery plan, and they insist that now is the time to prepare. Let's get to KOMO's Michelle Esteban with that story. Michelle?
Well, hi there, Eric. These mayors say they are just getting bombarded from citizens and from residents who are struggling for answers. These mayors say they want to help the governor. They've been hearing all about a plan, but they want to see the details. They need guidance, and they say their people need hope.
The standstill is all around us, from the few who wait on a bus in Marysville.
People are very, very eager now to begin the process of reopening.
To the quiet streets in Everett.
They're losing their business, and they need that information of what's next.
The worry is nonstop. That is why 16 mayors in Snohomish County fired off this letter to the governor. It's a call for a recovery plan that is desperate for hope.
We've got to have more details.
They want to know what to tell their cities, what's the plan, so they can start preparing.
We would benefit greatly from being more a part of the process.
If the governor is transparent with them, they say they can be transparent with their communities.
I am so proud of the work that our state has done.
The mayor says public safety should guide the recovery plan, but insists now is the time to determine which sectors could open first and start preparing those businesses with safety plans and protective gear.
This fleece balaclava I wear to cover my mouth.
Marysville's mayor says the county's done a good job flattening the curve, and he thinks with proper guidelines, small businesses could open quickly.
If you've got a small shop with very few people in it, where you can easily stay 8, 10, 12, 20 feet apart, or you can mask if you're close together, can we begin to trust the business owners?
Locals told us they're glad county leadership is on it, but relieved to know that their strategy is measured.
Why make the sacrifice if you're going to throw away what you've gained?
I think opening too soon would be a mistake. I think we're doing really good.
Driving through Seattle, a grassroots effort to strike over rent. The effort etched on the side of this building in Wallingford, graffiti in Lake City, and this sign in Capitol Hill.
A rent strike is an option, but right now it's sort of the last resort.
Carl Lawrence is one of the near 40 tenants at the Ben Lamont Apartments in Capitol Hill, calling on property owner Cornell and Associates to cancel or discount their rent.
Is that fair to make them pay for it?
Yeah, I personally think it's absolutely fair. I think those who have access to wealth and resources have the responsibility to share that with people who actually need them.
And Lawrence now has the support of City Council member Shama Sawant, who advocated for tenants' rights during today's City Council meeting.
The big landlords, the big banks, the big mortgage holders, they are going to be able to weather this crisis, and they need to absorb the cost of this pandemic, not working people, not struggling small businesses, and not small landlords.
But should and can landlords absorb rents? According to the National Apartment Association, just 9 cents of every rental dollar goes back to the owner. And Cornell and Associates co-president Bart Flores said absorbing May's rent is neither fair nor feasible.
Landlords shouldn't have to shoulder that, and secondly, we simply can't afford to. We go broke.
Carl fears the same, hoping compromise can win over.
A rent strike is not our goal. Our goal is to engage in any sort of negotiations with Cornell and Associates.
As concern continues about PPE shortages for our frontline workers, Tom Rupert emailed KOMO News this question, asking about reusing personal protective equipment. If the virus only lives on paper/cloth for a limited time, why are the PPEs being used by frontline personnel being discarded? Why not just put each day's PPEs into a secure room and use them over again the following week?
Great question about reuse of PPE. And in fact, most hospital systems, all hospital systems that I'm aware of, are in fact reusing some PPEs.
Dr. Mead says there are protocols for what's called extended use and reuse for PPEs.
For extended use, that's things like wearing the same mask all day, never taking it off in between, and so that you're not contaminating yourself by touching it. So that's what we think about extended use. And then for reuse, there are very specific decontamination protocols that masks, particularly N95s and other types of PPE, go through in order for them to be usable again.
Tom had another question about frontline worker eye protection, saying, If you can contract the virus through droplets suspended in the air, why do the people working with the infected patients wear eye protection that completely seals the eyes from the surrounding air? Adding, wouldn't something like swim goggles be a better eye protection to prevent the possibility of contracting the virus through the eyes for airborne droplets?
There are places that are using different types of goggles. The reason that many places use face shields rather than goggles is because goggles can often fog up. And so if you're directly providing healthcare to someone, you need to be able to see very clearly. So that's not always the best solution, but there certainly are places that are using them.
The race against COVID-19 means so many frontline workers desperately need PPE. Emergency management in Pierce County receiving PPE by donation from the state, and they're procuring their own.
We've been meeting that demand as best we can with supplies that we are able to acquire.
The county has gotten enough supplies to be able to provide for all 4 tiers of the state's prioritization guidelines. But in Olympia, supplies procured by the state still only enough to provide for the top tier: hospitals, EMS, and long-term care.
Procuring personal protective equipment has been an urgent priority since day one of this crisis, and unfortunately it remains so.
As of today, Washington has received almost 17 million items of PPE, but the state is still waiting on orders of more than 287 million items to arrive here in Washington.
We just need more of it to start materializing faster.
Much of the items are coming from China when the global supply chain is under tremendous pressure.
Is the state coming closer to meeting the demand of PPE here in Washington?
If we start to see larger and larger volumes of what we have on order materializing at a more rapid clip, then we're hopeful about being able to meet the most urgent needs.
Another urgent need in Washington: supplies for COVID test kits. Now the state says the federal government has indicated they'll use the Defense Production Act to help get kits where they are desperately needed.
But we've heard from the federal government that in the relatively near term, that is on the order of weeks, not months, that they will be in a position to meet those needs.